Okay, great. That was wonderful, Cristina. Cristina said that she's doing this every day in the lab, and what she's really doing every day in the lab is curing mice diabetes. She's not curing human diabetes. In fact, they've just started the first clinical trial in humans. And what Cristina didn't tell you is that most clinical trials fail. Cancer has been cured in mice hundreds of times, and when those clinical trials are moved to humans, they fail. So, yes, it's promising. Are we curing them now in Cristina's lab? No, we're not. Cristina argued that there's a lack of donors. If everybody who died was willing to donate their pancreas, could we have enough pancreata to cure diabetics? You better believe we could, because it's only type 1 diabetes that we're thinking about. Type 2 diabetes can be controlled by diet and appetite. The number of type 1 diabetics could easily be treated by, if everyone in the world donated their pancreas on condition of death. So we don't necessarily need to go to these complicated tea bags that have embryonic stem cell produced cells that are going to be beta cells. I should also say one of the ways that Cristina knows that she has pluripotent ES or IPS cells is she takes those cells and injects them under the skin of mice and sees if they form tumors. Because those pluripotent cells form tumors under the skin called teratomas, and the mice die. So Cristina is now going to try and purify some human insulin-producing beta cells from pluripotent cells. But of course, they can't purify it 100%. There's going to be some contaminating cells, and some of those contaminating cells are going to be pluripotent cells that cause tumors. And so Cristina will argue that, yes, we've done some experiments in mice, and they don't form teratomas in mice when we transplant in IPS or ES-derived beta cells. But of course, mice only live for 2 years. If it takes 3 or 4 years in the 80-year lifespan or 90-year lifespan of a human for those IPS contaminating cells to form tumors, a 2-year-old mouse is not going to find them. So Cristina may, and I hesitate to say, may cure diabetes, but she's going to kill you with cancer. So what's the alternative? There's no cancer-producing cells in the islets when we transplant them in. That works. They may just have to have multiple transplants. The autoimmune problem that is at the basis of type 1 diabetes is going to be a problem both for the types of cells that Cristina is making as well as for the islets, because she's putting them in these tea bags, but these tea bags break. They're not perfect. And in fact, they have a hard time getting all the nutrients into the bags, and it's possible that if enough nutrients get in or blood vessels pierce through the bags, then the immune system will get in as well and attack those beta cells that are in the little tea bags. So the real future is not embryonic stem cells or IPS cells. It's a secret population in the islets. It turns out that if you look at all the beta cells, about 0.5% of all the beta cells aren't mature beta cells in the adult pancreas. They're pancreatic stem cells that, if you isolate them, can actually proliferate in a dish and make huge numbers of new insulin-positive cells. And so the real cell type, I think, for treating type 1 diabetes is going to be an adult pancreatic stem cell. And there's a few advantages this cell has. One is it doesn't make tumors. 2, it only makes pancreatic cells. One of the other things that Cristina didn't tell you is, of course, that the ES and IPS cells make 60 or 70% insulin-producing beta cells, but they make other types of cells too. They make some bone cells, they make muscle cells. Who wants to be injecting bone and muscle cells into the body? No one wants to do that. Pancreatic stem cells, adult pancreatic stem cells, only make pancreatic cells. We know that those cells can actually work in some animal models of diabetes. It turns out that if you don't cause an immune reaction, but kill off 80% of the beta cells with a special genetic trick, the stem cells that survive can actually repopulate the beta cells in vivo and reverse the diabetes caused by a drug injection. So these cells have the ability to treat diabetes, adult pancreatic stem cells, and the problems that Cristina has with the autoimmune attack is going to be a problem both for the solution I'm suggesting as well as the solution that Christina's suggesting. So the future is not ES-derived cancer-producing cells. The future is adult pancreatic stem cells. Thanks.
See what I meant when I said it's tough? And now I understand why you said to me, do you want to go first? Okay, I'm going to address all of his points. First of all, unfortunately, we do not live in a perfect world where everybody decides to donate their organs. So we will not be able to cure everyone with type 1 diabetes with transplantation. And second of all, yes, we are curing mice around the world, but because we are launching clinical trial in the US and Canada soon, I think we're going to be soon seeing the fact that we can cure patients with type 1 diabetes. When Derek says that we're using cancer-producing cells, this is actually not true. We and others are becoming really good at generating these pancreatic cells. And so very rarely, of course it's a possibility, very rarely this population of cells that we transplant right now in the mice will form a tumor. We have a collaboration with scientists in Edmonton showing that even if you have a tumor, this tumor will not spread into the animal. But would you imagine the FDA approving something that could form a tumor and killing the person? No. And that's why we have a very good device. When Derek said to you that the device break, this is a lie, because they have tested the device. They've tested the device with, I don't know exactly what they put inside, but they tested how many cells it would take for this device to break. And it would have to bulge really a lot, something that, because the device will be transplanted under the skin, the patient would notice, right? So you will be able to remove the device before it bursts and before it destroys, it releases the content. So I think in terms of safety, we have a very good solution. I do agree that maybe we don't have the best device in terms of supporting the cells inside, but as we speak now, there is many companies and many universities around the world that are trying to define the perfect device, something that will allow the cells to survive and thrive and function. So I think, we can only get better in terms of cell preparation and, and device to treat type 1 diabetes. This is going on. We're not going to start it. It's going to soon change the way we see and treat this disease. And at the same time, I'm just going to use one more second, we're actually going to use the cells, we're going to use iPS cells from patients with type 1 diabetes in the lab to study how the disease happens. Because it's an autoimmune disease, we want to study how the cells of the immune system attack the disease and eventually figure out ways to stop the disease from happening. And so I think that will be the future way to actually cure the disease. So I'm going to leave it to Derek now.
I think Cristina may have too much faith in big government and big science. She said, can you imagine the government approving a drug that would cause cancer? The government approved thalidomide, right, which caused birth defects and short limbs and all kinds of problems in kids. I think there's a history of the government approving therapies that end up being worse than better. Part of the problem is that people do experiments in mice. And as I said, mice live for 2 years. And yes, they don't get cancer or they don't have other deficits in 2 years, but humans live for 80 years. So are we going to approve a cancer-causing ES-iPS cell that may not cause a tumor and burst out of the tea bag in a year, but if you give it 5 years, it's going to do it. It's going to burst out. It's going to go all over the place, and you're going to kill them with cancer. Cristina mentioned that they're getting very good at convincing ES and iPS cells to become beta cells. But what she didn't say is the best enrichment she's got is 60% of the cells that are produced from an ES and or iPS cell become insulin-producing beta cells. And even when they become insulin-producing beta cells, they're not as exquisitely sensitive to glucose in their release of insulin as are the cells in the adult islets, or as are the cells produced by the stem cells that are in the adult pancreas. When you get them to proliferate and make new beta cells, those cells are exquisitely sensitive to the levels of glucose and release insulin exactly in the right amounts. So I think that although there's promise and there's hope, I think the hope in big government and big science is not going to be the answer. I think the answer is going to be in using the endogenous system, using the endogenous stem cells in the pancreas to eventually, in the short term, we'll be transplanting them, take out the adult pancreatic stem cells from the islets, proliferate them, make insulin cells, put them back. But in the long term, the real solution is going to be to have the stem cells remake the pancreas and reproduce the beta cells from the inside of the body. This is the real hope of stem cell biology in general, is once you realize there are adult stem cells in tissues in the body, can we convince them to rebuild an organ or a tissue from the inside, not from transplants and surgery, but from giving drugs that will then cause those cells to proliferate and turn into the types of cells we want. So I think this is the real future of treatments for diabetes. Thanks very much.